Hello, I am Patrick Elsing. I am a senior health administration major at Arcadia University, and I am here with Dr. Stephen J. Barrer, who is an Abington health physician specializing in neurosurgery. He is the former chief of neurosurgery and director of Neuroscience Institute at Abington Health. We are here to talk about his new book, Exercise Will Hurt You. And what inspired you to write Exercise Will Hurt You?
This started out as an essay to myself. I have never been a disciplined exerciser. I don't really enjoy exercise. I do enjoy sports, but I've never participated in any sport where I haven't hurt myself. So as I got older and less inclined to beat myself up with exercise and sport, I started writing about why it might not be a good idea, especially at my age, to not be real aggressive in writing, in sports. So as the writing progressed, I realized that I may be onto something. And then about 4 or 5 years ago, I broke my wrist bicycling without even falling. All I did was run off the road onto the shoulder, and then as I came back up off the shoulder, the tire impacted the edge of the road, and just that shock wave coming up through the front fork fractured my wrist. I didn't even know it until about 6-8 hours later. And that particular fracture is one that has a high rate of failing to fuse. And as a surgeon, that could have been a career ender for me. So luckily, it fused fine, everything went well, and I actually talk about that story in the book. I realized that there's something out there that maybe people don't really know about and don't realize. And so I started researching and thinking more about what is it we do that we don't really understand, and might there be a way to disseminate information to people so they know what they're getting into and what they are up against. And so I had about 100 pages, and then through a series of really fortunate events, it got to the hands of a book agent who just happened to be Kurt Vonnegut's book agent when Kurt Vonnegut was still living. And he liked the book, and he said, I'm going to get this published for you, and he did. But then it became a lot of hard work, and it was no longer fun to write because I had an editor and a publisher, and they gave me assignments and deadlines, and I wasn't just writing for myself anymore. I was writing to accomplish an end, and then it became a book. And so that's kind of the evolution of what it started out as and what it ultimately became.
Now, I don't know if you could have a more direct title to your book, but explain the title, Exercise Will Hurt You.
Well, my original title was Exercise is Bad for You, because I thought it was catchier. And that's, however, just not true. And nowhere in the book do I say that exercise isn't good for you. But it will hurt you. And I say will rather than can because I don't know anybody who exercises or plays sports who hasn't hurt themselves in one way or another. And just using my own history as an example, not only is the injury rate 100%, it's more than 100% because everybody has more than one injury, unless they never do anything. So that's what it is. It's a fact that exercise, regardless of what's good about it, regardless of how much fun it is and how much you enjoy it, you will hurt yourself.
Yeah. So what are some specific common injuries that people come to you?
Well, I am a neurosurgeon, so I deal with diseases and illnesses and injuries of the brain, spinal cord, and peripheral nerves, which is what I see a lot of. I've spent a career taking care of concussions and problems with the spine. The problems with the spine are more cumulative than acute. There are obviously acute spine injuries, and we do see those. But most people who come to me with, excuse me, with back pain and neck pain, arm pain, leg pain, all the kinds of things that go along with the aging spine, are often making things worse for themselves by doing certain kinds of activities or sports that over time accumulate the kinds of problems that lead to them ending up in my office. The book deals with all kinds of injuries. I spend some time on the injuries of joints and musculoskeletal system because those are the most common ones.
Yeah.
Everybody who does anything athletic has turned an ankle or pulled a muscle or strained a ligament or worse, torn a ligament. So I talk about those, and I talk about the pathophysiology of muscle injuries and tendon injuries and ligamentous injuries. But I don't dwell on that because that is part of everything. Every exercise, every sport has that as a part of it. So I do talk about that. And if I mentioned every kind of injury anybody could get exercising or playing sports, the book would be 5,000 pages long. So that was not really the goal. The goal really was talk about more of a concept of how exercise can harm you. And so I bring in examples. I talk a lot about head injuries and concussion because it's very topical, and that's also what I've spent a lifetime taking care of. And also as more and more information comes out about those kinds of head injuries and how pernicious they are. So I dwell on those to some degree. And my target audience there is really more parents than the athletes, because the athletes are often children and in school and still living at home, and it's the parents who are going to decide whether the child participates in contact sports or not. And then I talk about some odd things, and I try to keep it funny. I mean, I think the book is funny. Anybody who's read it so far has told me they think it's funny. And so I talk about a lot of oddball things, especially with some of the more crazy extreme sports that are out there. I talk about running and marathon running and that sort of thing, and how that can set you up for injury. And I talk about some things you just wouldn't think about. I talk about injuries while gardening. And I use my wife as an example because she loves to garden, and that is her primary way of staying fit, and she is very fit. On a summer day, she'll be in the garden the whole day. So it's that sort of thing, and I jump around a little bit, and I've actually been criticized by one reviewer for being a little bit disjointed, but I did that on purpose because I wanted to show an overview and show the reader that no matter what you do, there's some danger lurking out there if you're not careful.
Yeah. So it's not an if you get injured, it's a when you get injured. I think
Absolutely.
that's clear. And so you will get injured regardless of how you exercise your life. It's inevitable. But how would you go about preventing these injuries the best way possible?
Well, one thing is to recognize them. A lot of individuals who exercise deal with pain and soreness on a regular basis because they feel that it is just part of the exercise or part of the sport, that they have to have that as a fait accompli. But those are injuries. If your leg is sore or your knee hurts or your back is bothering you, it's been injured, and you have to recognize that. And then you have to make a decision for yourself. Well, am I going to persist with this sport because I love it, or because I have a scholarship, or because it's the way I make my living, or because it's the way I want to make my living? In which case you will do cumulative damage to yourself. And if that's your choice, fine, but you should know what you're up against and what you're exposing yourself to. If you are a child and you're playing through aches and pains, it'd be helpful for the parents to know what's going on, and maybe the parents will make a decision that a child might otherwise not. So by recognizing that sort of thing, then you can make decisions as to how to best help yourself and how to best treat yourself. As far as the whole concept of pain, I talk a little bit about no pain, no gain, and how I think that's a kind of a silly saying, because no pain is good. Pain is bad. So if you're really hurting yourself, you may be gaining in the short term, but you're going to harm yourself in the long term.
Yeah, regarding no pain, no gain, someone may say, I don't want pain, so I'm going to take his advice and not exercise at all. Would you recommend not exercising at all?
No, and that is one of the knocks I take from people who just look at the title and think that it's an anti-exercise book, and it's not. It's an attempt to educate people. I think that if you take that attitude, based on this book, you've misinterpreted the book. The concept of dealing with pain is really one that, as I said, is a personal decision as to how much pain you're willing to put up with. And we all have that when we start. If you start exercising and do something new, your muscles are going to be sore. That's the whole lactic acid buildup thing and straining the muscles, and that's okay. Strain them a little bit and get a little bit of a burn, but then quit. And then the next day, if it took you 5 minutes to get that far the first day, maybe it'll take you 6 minutes to there the second day, and you'll slowly be able to stretch things out, exercise longer, and accumulate the positive benefits of the exercise. But if on that first day and the second day and every day you just push yourself until you are in incredible pain, you're going to harm. Yeah, maybe you'll get fit faster, but you'll get injured faster too, and the injury will be worse. So I just recommend to people that they recognize what their bodies can tolerate and listen to their bodies. And a 25-year-old body says things a lot differently than a 60-year-old body. Trust me, I've been both. So you have to understand what you can and can't do. And I talk to my generation as the baby boomers. We were all born in the 50s and early 60s. And we were the first generation to incorporate exercise as part of our lifestyle. Something my parents' generation never did. They didn't really have to. That generation was more physical. There were less labor-saving devices, and that really wasn't a thing for my parents' generation. But my generation began exercising really when we were in our 20s and 30s, and we continued to do it throughout our lives, and it became important to us personally. From a health perspective, the whole exercise industry has expanded really since the 50s and the last 50, 60 years. So there isn't anybody I know in my generation who hasn't had exercise as an important part of their life, at least at some stage along the way. But they forgot that they got older, and they became 50 and 60 and remembered that they really still liked exercising and thought they were 20, and they're not. So it's that mindset that I speak to as well.
What is the safest way you can have exercise?
Well, I'm not sure there's an answer for that. It depends on the exercise. I mean, safety in indoor rowing machine, which is pretty much what I do, is a lot safer than base jumping. And but both can be done safely. But if I'm base jumping, and I've done everything possible to make it safe, but I can't steer myself away from a bridge cable, which actually is what's happened. And a base jumper struck a bridge cable and it was cut in half. I mean, that's a whole different level of injury than my back starting to hurt on an indoor rowing machine. So there really isn't anything that can be done without any chance of harming you. You could say the same thing for any kind of non-exercise activity. Walking down the street, you can sprain your ankle. So that wasn't the goal of the book. Wasn't to teach you how to exercise safely. It was designed to educate you about what you should be looking for and what your body can tell you and how you should respond to what your body's telling you.
Yeah. So the overall theme of the book is that exercise isn't risk-free. Exercise has its risk just like everything else in life. And you wouldn't go into surgery without knowing the risks and possible complications, and therefore you shouldn't go into exercise without thinking there's any risks involved.
And I actually make that point in the book. I call it informed consent for the exerciser. Yeah. As a surgeon, and I talk about this, I have to spend a great deal of time with the patient prior to surgery, discussing the surgery, explaining why I think the surgery is necessary, what alternative therapies there are to the surgery, what the surgery can accomplish, and most importantly, how the surgery can harm them. And if I don't do that, I am not only remiss in my role as a physician, I am legally liable for withholding necessary information for a patient to make an informed consent. There's actually a legal definition of informed consent. But no one ever talks to you about that if you go to a sporting goods store and buy a $3,000 exercise machine, a stair stepper, or a treadmill. They don't tell you how that can hurt you and how you might harm yourself using that piece of equipment. And so that's what the book's for. Yeah. The book is the informed consent.
Well, that's just about all the questions I have for you. This book is available, Exercise Will Hurt You, at Amazon, Barnes & Nobles, as well as exercisewillhurtyou.com, which will lead you to all places where you can purchase the book and just more information about the book in general. Is there anything else you would like our audience to know about the book?
I think you covered it nicely. Thank you very much.
Thank you.